Can texting too much hurt your thumb and cause pain in your wrist or your thumb? Well, there is a condition called the Quervain syndrome. And I will show you one simple and easy clinical test that can help us identify this condition and possible damage of the tendons that control the thumb. Some doctors believe that the Quervain syndrome is a repetitive strain injury, and they claim that if you're texting too often and too much, you could unintentionally damage your thumb and the tendons that control its movement. But many doctors do not believe that the Quervain syndrome is caused by texting, but rather by other unknown factors. So this scientific discussion can be very complicated and long, but you know what is not complicated? Performing a simple clinical test to see if the damage to your thumb in your wrist has already been done and if the tendons are affected. Despite not knowing precisely what causes this condition, we have quite a few treatment options for your pain in the wrist and the thumb. So first, let's look at the wrist. This, what you can see here, is the wrist and the hand from the posterior perspective. Now, if we look closely over here, you'll be able to notice the tendon of the abductor pollicis longus running underneath this ligament over here, the dorsal carpal ligament. The tendon of the abductor pollicis longus is actually running this way together with the tendon of the extensor pollicis longus. It can be very hard to distinguish them here from one another. These two muscles perform very important functions, and without these two muscles, it would be very hard or almost impossible to text using your smartphone. To reach out and tap on the character A on your smartphone, you would be using the abductor pollicis longus in order to move the thumb away from the hand and other fingers. The extensor pollicis brevis, however, helps us elevate the thumb away from the display so that you're not swiping across the screen. Now, if you do use a swipe type of keyboard, you might be using the extensor pollicis brevis less, but you still have to use it at the end of the word when you're done with swiping. Because these muscles and their tendons perform specifically these texting movements, it is easy to understand why many doctors believe that the Quervain syndrome is caused by excessive texting. Doctors who believe that excessive texting can cause the Quervain syndrome claim that excessive texting causes the thickening of the abductor pollicis longus and the extensor pollicis brevis tendons. They claim that consequently, this causes pain in the wrist and the thumb. Now, if this is true, we don't really know, but there is a very simple and easy test that can be performed in order to see if the patient truly suffers from the Quervain syndrome. But before I explain this final step, I would like to ask you to do something. In order for us to help other people learn about this possible cause of wrist pain, we need YouTube to suggest and promote our videos, but that will not happen unless we get enough of likes and subscribers. So if you can, please go ahead and like this video and subscribe. Now, how can we test if the patient suffers from the so-called Quervain syndrome? The test is called the Finkelstein Test, and it consists of placing your thumb in the center of your palm, and this requires the exact opposite movement of what abductor pollicis longus and the extensor pollicis brevis perform. The whole point here is to stress the tendons of these two muscles, and this can further be achieved by grabbing your thumb with your other fingers and then flexing your wrist in the ulnar direction like that. So the Finkelstein test is basically grabbing your thumb and then flexing your wrist in the ulnar direction. And if the patient experiences pain, well then we consider this Finkelstein test to be positive, and it indicates that the patient is suffering from the Quervain syndrome. But there are many other causes for pain in the wrist, and a competent doctor should be able to diagnose them. Both of you doctors and patients, we can all benefit from videos like these. If you're a doctor and you want to make a video like this one, then go to anatomsky.com. But if you're a patient or you have more questions about the Quervain syndrome or pain in the wrist, then go to this link, symptomsky.com/help/wrist.